A patient's death leads to a shocking report that reveals more than 100 problems with blood labeling at Baylor St. Luke's Hospital.
The hospital's new president calls the report deeply disappointing.
And Sherman Chow has been looking into the reports. What did you find today, Sherman?
It was indeed a deadly mistake, and this is how it all started. A patient back in December was discharged, but her extra blood tubes or vials were left behind. So when a new patient, patient B, checked in, a nurse accidentally placed the new labels onto the old tubes. So one blood sample had two different patient stickers on it, and patient B got the wrong blood type and died. Medicaid, Medicare, and the Texas Health and Human Service agencies did these reports. Over a 4-month period, they found 122 instances of blood labeling issues. Findings included failure to discard extra blood vials or to search a room for extra vials after a patient is discharged. The lab failed to reject a vial with two different labels. Staff failed to recognize possible signs of adverse reaction to a blood transfusion. And other patients also had health issues because of mislabeled blood and transfusion problems. The once storied St. Luke's Hospital in the Texas Medical Center has temporarily suspended its heart transplant program last year after higher than average mortality rates. Medicaid, Medicare cut its funding for heart transplants because of poor outcomes. St. Luke's deemed status has been temporarily suspended, meaning that it does not currently meet certain Medicaid or Medicare requirements. In an open letter, the hospital president included that corrective actions have been made, including reviews of documentation processes, implementing audit processes, and staff education, and more. Citing those changes, the hospital is now asking to reinstate its deemed status. Guys?
What an ordeal. Sherman Chow, thank you. Well, you have questions.